Hi, my name is Natasha Hanwright, and this is my partner, Katie Ho. The article we have chosen is assessing the health-related fitness of middle and high school children with the Polar TriFit system by Alekin, Scales, and Collins from the Journal of Cardiopulmonary Rehabilitation and Prevention. Obesity has been associated with some of the nation's biggest killers, such as cancer, heart disease, and diabetes. They have all been closely linked to obesity. According to National Cancer Institute, obesity can cut a person's lifespan more than smoking. Children become overweight and obese for a variety of reasons. The most common causes are genetic factors, lack of physical activity, unhealthy eating patterns, or a combination of all these factors.
The obesity epidemic poses one of the greatest public health challenges for the 21st century. The World Health Organization reports that the number of overweight people in the world now equals those who are underfed. It is estimated that 2/3 of American adults are overweight or obese, and an estimated 23 million children are either overweight or obese. Physical education courses should provide adequate physical activity and educate these children about the benefits of physical fitness. One of the major issues is that children are not aware that they are even overweight. Physical education teachers are not able to adequately assess all the students in a timely manner, so many of these children are unaware of the potential health implications. TriFit Polar has been a leader in fitness technology over the past 30 years, and they have developed new products specifically for children to measure and document their curriculum. They receive heart rate monitors and assessment technology.
Methods were used self-contained multi-station computerized assessment devices with customized software designed to quantify and track measures of health-related fitness and generate individual or group progress reports. In this preliminary analysis, height and weight were obtained to calculate body mass index scores. The major results were that 19% of the boys and 9% of the girls were considered to be overweight, determined by International Obesity Task Force. For the first time in history, the lifespan of parents is higher than their children.
Strengths from the article were that through TriFit, teachers were able to document their students' health status. They could track and document their students' health status as they equip their children with the knowledge to sustain lifetime fitness. Physical educators can develop personalized health and fitness portfolios and create customized exercise and nutrition programs. Some limitations were that some children have different metabolisms, attitudes, and may not comply with TriFit.
The scientists performed the study because of the increased childhood obesity and diabetes that became a national concern within the U.S., and this has increased questions about the way in which school systems have structured physical education programs. The lack of exercise done in the current physical education class may correlate to the increase in obesity and diabetes. More importantly, if the physical education teachers are not able to determine the level of fitness of each student due to time constraints, it increases the risk of the child becoming obese or developing diabetes because the teacher would miss important evidence or data.
The hypothesis was that the Polar TriFit system is a feasible method of effectively assessing measures of health-related fitness in a time-efficient manner during a school physical education program. With the Polar TriFit system, they would be able to assess the fitness levels of all their students. The results of the study were that 19% of the boys and 9% of the girls were considered to be overweight, according to values determined by International Obesity Task Force. They were able to assess all the students and determine their health status.
We chose this article because it was a topic that we were both very interested in. Preventing childhood obesity is important to us because we feel that it is the parents' and the teachers' jobs to educate these young children about childhood obesity and how to prevent it. As future healthcare providers, we hope to educate patients about healthy diets and healthy ways of exercising. The incidence of obesity and diabetes is increasing, and we hope that through educating children and their parents, we can bring it down and prevent any more obesity and diabetic patients. Although this article was not clearly written, we believe that it was very informative and interesting. We believe that the obesity epidemic is not being resolved and that government and schools should implement more policies to make sure children are eating the right things and being physically active. Physical education should not be just be an hour in a day, but it should also make sure that the children are being consistent and healthy. Thank you.
Thank you.